In this video, we'll learn about emergency care. So, what can you do if someone is having a heart attack? Oftentimes, there won't be obvious signs of pre-heart attack. This disease is usually asymptomatic until the later stage. Early signs of heart attack include feeling pain or discomfort in his or her chest and shoulders, tiredness, lack of energy, breathing difficulty, and so on. Everyone's complaints might differ, but when heart attack actually happens, one would experience sharp pain on his or her left chest for at least 15 minutes. Men and women have different symptoms. Often women do not experience any chest pain. Their symptoms are fatigue, disturbed sleep patterns, shortness of breath, indigestion, and anxiety issues. If you think you're having a heart attack, call emergency services right away. Do not wait, as every minute counts. A person's treatment options and chances of full recovery can be reduced by the delay of treatment. Call emergency services and talk with the operator who is trained to assist you. The 6 signs of heart attack. So, how do you determine whether a person is suffering from a heart attack? Here are the 6 signs of heart attack that you can take note of. Heart attack sign number 1. Chest pain or discomfort. For men, chest discomfort is the most common symptom of a heart attack. Usually, it's felt as a tight, heavy, or burning sensation. This usually starts in the middle of the chest, then moves to other areas of the body. Sometimes it's continuous, sometimes it goes away and then returns. Some people experience no pain at all, just discomfort or a dull type of pain, which can grow to be quite intense. Others will not have pain, just discomfort. If you think you're having a heart attack, call emergency services right away. If it's only chest pain, the person will still need to see a doctor. Heart attack sign number 2, discomfort or pain in other parts of the body. The symptoms of a heart attack can also manifest in different parts of the body, such as one or both arms, the neck, jaw, back, or stomach. Different people, especially women, will experience pain or discomfort in the jaw or back during an attack. Heart attack sign number 3, shortness of breath. After someone does physical work, it's normal to have some shortness of breath. If this happens when you are resting, it's often a sign of heart failure. If your breath becomes unusual, take a short rest to normalize your breath. If your breathing does not become normal after 2 minutes, call emergency services. Heart attack sign number 4, nausea, sweating, or clamminess. Many people, especially women, when having a heart attack will feel nauseous, excessive sweating, or clamminess. These symptoms can also be indications of the flu, but if these symptoms occur abruptly, or if you also have other indications of a heart attack, call emergency services immediately. Heart attack sign 5, a general feeling of extreme fatigue or weakness. Sometimes the first complaint you may hear from a heart attack patient is general weakness or fatigue. It might not sound like much, but this is a common indication that most potential heart attack patients experienced prior to the attack. But this symptom alone is not enough to diagnose or expect a heart attack, as there are too many causes of weakness and fatigue. It could be due to lack of oxygen, not having enough sleep, poor eating habits, anemia, arthritis, and others. But if other signs of heart attack are present, do not hesitate to call for emergency services immediately. Heart attack sign number 6, collapse or falling. Often a person with heart attack will collapse or lose consciousness, unlike other chest conditions where this rarely happens. Again, if you find someone collapses and lose consciousness, bring him or her to an open area and call for an ambulance right away. Early warning signs of a heart attack. Heart attacks usually give a bit of a warning before they happen, except with heartbreak attack. Often this can happen days or in some cases months before an attack is imminent and the heart muscle becomes damaged. High blood pressure is a sign of possible heart disease. Chronic heartburn can be an indication of heart problems. Reduced cardiovascular fitness and shortness of breath. high blood LDL cholesterol levels, the feeling of being unwell or run down before a heart attack. There are lots of reports of people feeling a sense of impending death before experiencing a heart attack. This is quite common and may have something to do with depression, which is also an indicator of heart problems. Abdominal pain and indigestion is a common sign, especially for people over 55. Because of the similar symptoms in many different conditions or diseases, it can be hard to tell that you are experiencing a heart attack. So, look for several symptoms. The more symptoms you have, higher the chances you are having or will have a heart attack. Routine checkups from your health provider are advisable for prevention and cure. What to do before help arrives. Having a heart attack is a traumatic experience. Often people will panic when having a heart attack, so try to remain calm. If you are helping someone, assure them that help is on the way and that things are okay. It will help calm them. Keeping calm is important. The best recovery position is when sitting in the W position. This is with the back supported at a 75-degree angle and the legs bent so the knees are up and the feet flat on the ground, forming a W shape. Another position that is recommended is to lie flat on your back with your feet up above your heart, the Venus position. This opens your diaphragm, it makes breathing easier, and increases the oxygen supply. Once the person is comfortable, all tight-fitting clothing should be loosened to avoid any restriction, but do not allow them to chill, so ensure the person is covered. It is important that the person does not walk around. Lying or sitting in a relaxed position without pressure on the lungs is best. Do not ask unnecessary questions or distress the person, but do check for any medical bracelet or tags and try to find out if they have any medical condition or are carrying any medicines. If someone is expecting a heart attack, they may be carrying aspirin or nitroglycerin. Usually they will know the required dose. Help them to take a small amount. If a person's heart stops beating, it becomes necessary to start CPR, but it is important that a person administering CPR is trained correctly. If you do not know how to do CPR, then doing heart compressions is the best option. When CPR is administered, as soon as a person's heart stops beating, even before help arrives, the person's chances of survival are drastically increased. What to do if you are having a heart attack when alone? Most people are alone when they have a heart attack. The first thing you should do is call emergency services. Give your location first, then your name, and try to state your problem. Only after you have summoned emergency services should you call others such as friends or family. The emergency service operator is trained to help you in cases of emergency, so follow their instructions until help arrives. If you are completely alone and do not have a phone, there is still one thing you can do that may save your life. This self-procedure is controversial, but it has been suggested that it could make matters worse if not done correctly. But if you are alone and there's no one available to help, then this is a viable option. Take a very deep breath and then cough vigorously right from the bottom of your chest, the same way a cat will cough to get rid of a fur ball. For this to work effectively, the person needs to take a very deep breath, about every 2 seconds. Breathe in and make a deep, prolonged cough. This procedure has to be maintained until help arrives, or your heart regains a regular rhythm and is beating normally. What this procedure does is to bring a large amount of oxygen into your lungs. The coughing squeezes the heart and keeps the blood moving. This squeezing pressure on your heart at about every 2 seconds will help your heart regain its normal rhythm. By doing this, you should be able to get to somewhere where you could find or call for help. In this video, we'll talk about risk factors for heart disease. There are many risk factors that you do not have any control over, such as your family history and age, but there are many factors that can contribute to the likelihood of having heart problems or a heart attack. Therefore, to reduce the likelihood of heart attack, you have to change your diet, lifestyle, and attitude. Most people will have at least one condition or habit that is a major risk factor for developing heart disease. Each one increases your chance of developing MI, as each risk factor you eliminate will substantially reduce your chances of heart disease. Now, let's talk about the risk factors for heart disease. Genetic or family history. If you have a family history of people with heart disease, this can increase your chances of developing a similar type of condition. But it does not mean that you are destined to develop a heart condition. It only means you're more likely to have this condition. If you take the necessary steps to look after your heart, you can reduce the chances of developing all forms of heart disease. After menopause, some women are more likely to develop heart problems because at this stage of their life they are producing less estrogen, so they need to vary their diet accordingly. Statistics have revealed that African Americans are a group that has higher instances of diabetes, high blood pressure, heart attacks, and strokes than other groups. Obesity and its effects. Obesity is a growing global problem. Someone who is obese has 4 times the likelihood of developing heart diseases. Furthermore, those with a family history of high blood pressure or diabetes will have a higher risk for heart disease. Obesity is now recognized as an inflammatory disease. It's often thought to be a symptom or indication of other conditions a person may have, not as it used to be considered just an eating disorder. Different studies have confirmed that obesity is a major contributor to causing heart disease and heart attacks. Poor diet, the wrong foods, clogged heart vessels, strokes. There is absolutely no doubt that having a poor diet or a diet that is deficient in many vital nutrients is a leading contributor to the extremely high incidences of heart disease that have become a reality for many people today. Our foods have been stripped of a large portion of their natural goodness by processing and artificial methods used to grow them. Processed salt, highly refined grains, high fructose corn syrup, and refined vegetable oils are the 4 poisons that are found in most of our diets. The combination of these clog up the arteries and blood vessels of the lungs and heart, causing heart disease. Smoking. Everyone is aware that smoking is likely to damage your lungs, but many do not seem to realize that it's also one of the leading reasons for people to have a heart attack. In fact, about 1 in every 5 people who die from a heart attack do so because of smoking. If you smoke, you are at least 4 times more likely to get heart disease than non-smokers, and the risks are even higher for women who take birth control pills. Secondhand smoke exposure is also a risk factor for having a heart attack. The nicotine in cigarette smoke reduces the amount of oxygen your lungs can send to your heart. It also raises blood pressure and speeds up a person's heart rate. Nicotine is also known to harm the insides of blood vessels and arteries and to increase the chances of blood clots forming. Drinking. Moderate alcohol consumption may provide some health benefits, such as reduce your risk of developing and dying from heart disease, possibly reduce your risk of ischemic stroke, when the arteries to your brain become narrowed or blocked, causing severe reduced blood flow, possibly reduce your risk of diabetes. Even so, the evidence about health benefits of alcohol isn't certain, and alcohol may not benefit everyone who drinks. Everyone produces a small amount of alcohol internally each day as part of the metabolizing of food. This small amount of alcohol is absorbed and burnt as energy. Drinking a small amount of alcohol can help some people because it helps to raise good cholesterol, HDL, levels, at the same time reduces bad cholesterol, LDL, levels. It helps to stop blood clotting, tends to thin the blood, and allows for easier bleeding that could help to hold off a heart attack, but only if used in moderation. High cholesterol. Cholesterol has been blamed for heart disease for many years. But it is now known that cholesterol is in fact healthy. It is one of the most important substances the body produces. After all, the body needs cholesterol to carry out its functions. For instance, our brain and liver are made of good cholesterol. Our body can produce cholesterol on its own. However, problems arise when we consume too much bad cholesterol, known as LDL or low-density lipoproteins. Eating processed sugars, hydrogenated vegetable oils, and too much omega-6 fatty acids can cause an oversupply of LDL. LDL helps to carry cholesterol around our body to the areas that need it. When there is too much of it, the excess can cling to the walls of the arteries, irritating and clogging them up, preventing enough oxygen-rich blood from reaching your brain, heart, and other organs. Diabetes. People with diabetes tend to have a high blood glucose level, which can, over time, damage your blood vessels and especially the nerves that control the blood vessels in your heart. Many people with diabetes can develop heart disease at a young age, and those with diabetes are almost twice as likely to have heart failure as non-diabetics. As with all heart conditions, if you take proper steps to manage your diabetes, your risk factors will substantially reduce. Physical activity. Doing very little or no physical activity is a major cause of heart disease and heart attacks. This is because they can't burn up excess, so it's turned into fat. The body is designed to perform a certain amount of activity daily to keep it supple, healthy, and function properly. When the body takes in more food and energy than it needs over an extended period, this will lead to obesity, which can lead to many diseases. The body needs exercise to stay in peak condition, which is a good way to ensure heart health.